Hello, Sadie Morway here, doctorate in athletic training student at Indiana State. And with me, I have Nick, and Nick is going to be our model today for the foot demonstration for a Maitland mobilization of the great toe. So the great toe plays a really big role in foot biomechanics. Obviously, it's responsible for a lot of that weight that we have off of the toe off in our gait. So it's really important that we're able to get that full great toe extension. So this is a type of mobilization that can be used to help with patients that are limited in extension. You might have somebody that has pain with this movement too, so mobilizations can be beneficial in that capacity as well. Mobilizations are proven to really activate those opioid receptors and release enkephalins in the descending pain pathway. So it can be a reduction of pain in that way, but also it can improve joint extensibility and get that joint position a little bit more optimal. So we want the patient obviously in a comfortable position. This technique should not be painful at all. So make sure to communicate that with your patient. So Nick, what I'm going to be doing is I'm going to be grabbing onto your foot here. So we're grabbing the first ray. So this is the metatarsal. And what we're going to be doing is we're going to be pushing that first ray into a dorsal direction. So our goal here is to be able to promote extension of the great toe, but also where that first met attaches to the tarsal bones. So often we don't get a lot of movement through that midfoot. So this is a good way to do that. So keep in mind, you can do this technique at any piece of the phalange, whether that's in the foot or if you want to work on the toes too. So if you've got limitation through this first, the proximal joint, then you can do this technique there too. It's the same thing. You're just doing it at different places. So with this, it's really important to have a good hand placement. So I'm really grasping with the thenar side of my hand, giving that dorsal oscillation here. And oscillations can be done a lot of different ways. I like to stick with an oscillation where I get to that point, hold for a second or two, and then come back. So that's what we're going to be doing here next. So if you have any pain, obviously let me know, but this is all that we're really going to be doing. So I'm trying to open up that joint space, kind of forcing that a little bit more into that dorsal direction, hopefully improving that extension motion. So with this, Maitland mobilizations can be done a lot of different ways. There's a lot of different parameters. So you really have to gauge it based on your patient. I usually like to start with anywhere from 15 repetitions with a couple sets, especially if you're doing that 2-second hold. That can be just as beneficial according to the literature as some other options. Another option is to do a little bit quicker, and you can even just do that for a period of time. So you can set a timer for a minute. So really you just have to gauge it with the patient and with your comfortability with the technique. So that is a Maitland mobilization at the great toe, and this can also help to reduce plantar flexion. So that was some other research that I had found. So thanks very much.